Welcome, and this is Pia, and our guest today is Dr. Bobby Mukkamala, a practicing physician from Flint, Michigan, a national healthcare leader and 180th president of the American Medical Association. When he's not shaping the future of healthcare policy, he is seeing patients, fixing cars, and working to rebuild his hometown. Dr. Mukkamala, it's great to have you with us. Welcome to ITV Gold.
Oh, thank you so much for having me, and I find it amazing and enjoyable that I happen to be having this conversation with you from New Delhi instead of Michigan.
Absolutely.
So,
and thank you so much for joining us. And first of all, I want to congratulate you. You make us all so proud to be AMA president. And now my question to you is, when that result was announced, what was the very first thought that went through your mind?
Yeah, the first thought, because the people I'm going to mention were in the audience, and that was my mom and dad. Just the fact that I just think about the sacrifice that they made, leaving what they were most comfortable with in Andhra Pradesh and in India, coming to the United States when they're 25 years old, having their own careers in healthcare, and now their firstborn is president of the American Medical Association, which is responsible the physician's perspective for healthcare in this country. So I just thought it was amazing that they were witness to something that they themselves created. And so it was more of a celebration for them that was in my mind than anything that I did.
Absolutely. And you still run a solo practice in Flint. Why was it why is it so important for you to stay on front lines while leading nationally?
I think what I think about that is that we usually see people that reach these sorts of positions that are somewhat far removed from what got them into that position in the first place, right? So practicing medicine, learning about healthcare, and then becoming the president of the largest physician organization, you would think that there's no way this person could continue to practice medicine. But that's what I enjoy most, right? When I'm not traveling. So the president of the American Medical Association spends about 200 days per year traveling. But when I'm not traveling, like when I go home tomorrow from India, on Monday I'm in Chicago, but then Tuesday I'm in the operating room and I'm seeing patients in my office. So having the connection between being a leader within healthcare and seeing patients practicing healthcare, I think is a good connection to have because it's a more informed position that I have.
Absolutely. Talking about healthcare, talking about insurance, let's talk about Medicare. Like Medicare reform is a big focus for you. In simple terms, I want to know what's broken right now and what needs to change first.
I think what's broken is the physician's ability to do what we love, right? I love taking care of patients. My parents taught me that when my patients are healthy and they're happy, I sleep well at night. But the problem is to be able to do that, there's such a bureaucracy that's necessary to go through, right? Everything from dealing with insurance companies to, Medicare is the basis of all the payments that physicians get for taking care of patients. Even if they're not insured by Medicare, private insurance, their payment is based on what Medicare pays. And when that just doesn't keep up with the cost of maintaining our practices, people just give up, right? So we have a 50% burnout rate among physicians that plan on retiring early than they ever wanted to. And I think again about my parents. My mom is a retired pediatrician. My dad is a retired radiologist. They both practiced until they couldn't practice anymore. They weren't burnt out, they just couldn't physically do it anymore. They're both 81 years old this year. But that's not like that anymore. We're physically able to do it, but mentally challenged because of these burnout issues associated with everything from insurance to other paperwork. And that's what makes the joy in medicine go away. And that's why the AMA works so hard on bringing it back.
Dr. Mukkamala, since you are talking about the, burnt out thing, so tell me, there are, of course, you talk about shortages and burnt out. How real is the crisis from what you see, every day?
Yeah, so I love the way you asked that question because I do see it every day. And the example that I would give is that when I started my practice, this is my 25th year in practice. When I started my practice, maybe a few times per month, I see a patient that comes to me from an urgent care or emergency department. Now I see at least 5 a day,
Wow.
right, that don't have a primary care physician. They're going in and out of emergency rooms, in and out of urgent cares. This is the consequence of physicians just giving up and saying, you know what, I'm going to retire early, right? Instead of retiring at 80, like my parents, they turn 60 and they're counting the days before they stop practicing medicine. And so these are the things that totally affect the health of our country that we are working on fixing.
You know, talking about doctors, I hear a lot of doctors say like excessive charting and documentation are pulling them away from like patient care. So how do we resolve this burden while still ensuring accountability?
Yeah, so many of these things are influenced by what our lawmakers do. And then the reason I say that is, like, for example, prior authorization. The fact that when I see somebody being an ENT surgeon, when I see somebody that has a lump in their neck and they're smoking 1 pack a day, and I think this is a high risk of cancer, and I want to get an MRI scan, or I want to do a procedure. The fact that between the moment that that patient is in my office, and we both determine that, yes, this is what we have to do, and then the moment that we actually do that procedure is an unnecessary long time because of something like prior authorization, right? We have to ask permission to get an MRI scan. We have to ask permission to do a procedure. And so that creates a delay in care. And that's frustrating for me, and that's just the basics of it. But it's enormously frustrating for patients. And 50% of doctors describe a situation where the health of the patient has decreased while waiting for care.
Right.
And so these are the things that cause that frustration.
I mean, what can be done to fix it? That's my question to you.
Yep. Yeah. So I think that when we have these examples, it's optimistic to think that if we talk to an insurance company, they'll say, oh, you know what? You're right. Let's fix that. They don't say that.
Okay.
So what does that leave? It leaves us, the legislators, right, the lawmakers in Washington, D.C., to say, yes, doctors, we agree with you. It shouldn't be this bad. And then they are the one, they have more influence on the insurance company. And then they may convince the insurance company to fix something like prior authorization. So what's interesting about that particular example, in 2018, and then again in 2022, the insurance companies said, you know what, you're right, let's fix this. Nothing changed. This year, right, under Dr. Oz and Mr. Kennedy, once again, they said, you know what, yes, this is a problem, we're going to fix it. But this time the difference isn't just them saying it, it's the people in Washington, D.C. that want to see them tell the truth and actually do what they're going to say. So we are cautiously optimistic that they will fix this problem.
All right, doctor, we have seen we face shortages in fields like mental health, pediatrics, and rheumatology. And, certain specialties like plastic surgery and dermatology, they have access providers because I feel they are lucrative. So how do we resolve this discrepancy?
Yes, so, the way that we get to the point of practicing is, medical school, then residency, of course. And everyone thinks, well, we need more medical students. Actually, like in Michigan, where I live, when I went to the medical school at the University of Michigan, we had 3 medical schools in the entire state. Now we have 7.
Wow.
But yet we still have a shortage of physicians. Right now, it's almost 85,000 physicians. Within a decade, it'll be 100,000 physicians. And it's because the narrowest part of that funnel is the number of residency physicians. And then on top of that, when we look at shortages specific to primary care, right, family practice, internal medicine, it's even worse. And so these are the gaps that we have to close to increase the number of residency positions. And sometimes we have enough. Like you said, if you need a dermatologist in a big city, you'll probably find one. If you need a neurosurgeon in a small city, good luck. Right? If you need a primary care physician anywhere, good luck. Right? I used to think that this was unique to Flint, Michigan. Flint, Michigan is not the most desirable place to live, so it's natural to think that we're going to have some shortages of physicians. But then I find out that even in San Diego, California, one of the most desirable places, right? So Flint is here, San Diego is way up here as far as desirability, and yet
Right.
they themselves have a shortage of physicians, right? Pediatricians in particular. So these are the things that we need to work on to create a solution to that gap in care. Because without a primary care physician, when you're stuck going to urgent cares, when you're stuck going to non-physicians, the health is just not going to improve as well as it will.
You know, you're talking about the shortage areas, like international medical graduates, they're often required to repeat like full residencies despite prior training. So, my question is, would you support a streamlined pathway such as a specialty specific orientation to bring them into shortage areas faster?
Yes, we definitely have a shortage, and what's amazing, historically, international medical graduates were critical to closing that gap in physicians. Almost 25% of the physicians in this country are international medical graduates. Many are from India. Most of them are from India. And so when I think about my parents when they came here in 1970, you know, my dad took a taxi to the hospital. He didn't have hardly any money to pay the taxi. In the middle of the night, somebody walked out of the hospital, they paid the taxi, they brought my dad into the apartment, and the rest is history, right? They were that welcoming of international medical graduates. Now, if you want an H-1B visa,
Yeah, it's harder.
it costs $100,000, right? And so it's not the welcoming that used to be there. But yet international medical graduates play a critical role in those areas that are underserved. Right? And so yes, there needs to be a solution. One of those solutions you mentioned, which is to say, you know what, if you practiced neurosurgery in India for 10 years and you want to come to the United States, you have to go back to the first year of residency. That's pretty ridiculous. Right?
Exactly.
And so many states, because of the shortage, are saying no need to go all the way back. If you have that practice history, then we will observe you for 6 months up to a year. And if we think that you have the competence to do that on your own, there's no reason to go back to a multi-year residency. So that's very interesting. Of course, it's very early in that process, so we have to see how it turns out. So the AMA is very much looking at that to see what the results are for the communities and the states that that policy serves.
You know, Dr. Mukkamala, I know like you are a strong voice and you have been a strong voice for lifestyle medicine. So I want to know from you, like, why do things like diet, exercise, and prevention still get overlooked?
Yeah, I think, unfortunately, I think it has a lot to do with economics. Right? And what I mean by it is, you know, there's a highway I-75, goes right through my hometown from north to south. I live in 48503, and my parents live in 48439, just 10 miles apart. Life expectancy where I live is 68 years. Where my parents live, just a few exits down the expressway, is 81 years.
Wow.
13-year difference in life expectancy, just a few exits on the highway. That is a failure of our system. And yet, despite that, on the same highway, when you look at the billboards, every single billboard is about, do you have a stroke? Come to see us in our emergency department. Do you need your hip replaced? Come to see us to have that surgery. I have never seen a billboard in my town or in an entire country that says, do you have stage 1 hypertension? If so, call us. We will help you prevent it from turning to stage 2. Do you have prediabetes? Call us. We will help you from developing type 2 diabetes. Right? We never see those billboards. So the economics of healthcare in our country doesn't support prevention of disease as it should, because anyone that looks into this would say, we want to preserve health. Yes, we need to be great when something bad happens and take care of the strokes and tumors, but preventing those things is just as important, if not more important. One, because you have a happier patient. Surviving a stroke is great. Never having a stroke is even better. And then you think about the mathematics. If none of it was ethical and it was all financial motivation to make a decision, even that approach says, let's prevent disease, because it's a whole lot cheaper to invest in preventing a stroke than taking care of a stroke. We all know how much it costs when you end up in the hospital. There's a mega surprising bill when you're done. To avoid that whole situation by improving the lifestyle, and there's some principles that are very basic. So a plant-based diet, right? My parents are both vegetarian. I'm working my way there. I'm a pescatarian. But those plant-based diets is a critical aspect of just improving health. Getting 7 hours of sleep. I never thought of that before. But there's data that shows that getting 7 hours of sleep improves your health. Right? Exercise. Right? Less stress by being more social in our activities. Right? These are the basic principles of lifestyle medicine, which will make an enormous impact on prevention of disease. So I think as a country, since we spend more than any other country on the entire planet, almost $5 trillion a year, we need to get more for that investment. And I think that's going to come, not from being excellent at treating strokes and heart attacks, which we are, but instead adding this to that.
So, this is like just, I'm asking you that because, I eat plant-based food too. So I'm just, what do you think? Like, sometimes when I go to my doctor and I say I eat plant-based, they're like, oh, you are missing on protein. You are missing on this. You are missing on that. You need to have some kind of protein, What do you think about that?
Yeah, so yes, we need protein. There are multiple ways to get protein without eating meat, right? But it takes some conversation. I just had dinner with my father who lives in Vijayawada, and he's seeing us off from Delhi tomorrow. And as we were eating dinner, somebody said, you know what? How can you have a risk of myocardial infarction, heart attack, in India at a higher rate when there's so many vegetarians? Well, you can be a vegetarian and eat nothing but salty peanuts and potato chips and fatty food. None of it's meat, but none of it's healthy. And so that's why I think it's important to not say something like, you know what, you should be healthy, you're a plant-based diet. No, that's not enough, right? What we eat, even if it's not meat, needs to be something that we have knowledge about so it improves our health instead of decreasing our health.
So, but my question to you is, doctor, do we need a lot of protein? Like everybody emphasizes on protein diet, high protein, because I see a lot of my friends, they're on high protein diet, okay, and low carb, low carb is okay, but not, I think high protein sometimes maybe it's too excess of protein. So what do you have to say about that?
Yeah, so I'm a big fan of this principle of everything in moderation, right? Yes, we need protein to keep our muscle mass and keep functioning. Now, adding powdered protein to everything that we eat is overkill. So absolutely, we can have too much. So, but there's data about that, right? We have a lot of science. And what I also notice about diet is it's very trendy, right? Whatever famous diet is going on right now, in 10 years, we may realize that, you know what, that's not as good as we thought it was.
Right.
Let's switch to something else that's trendy. So it shouldn't be trendiness that drives us to what we want to eat. It should be the science, right? And then science is also evolving. We see that too. What we think now is not necessarily what we may think 10 years from now, but that should be the basis of what we act upon. The best we know now should be what drives us from everything, from what we eat to the exercise that we do and the lifestyle we live should be guided by the science.
Now, a personal question to you, like as a physician yourself, what's one lifestyle change you have had to work on personally?
Yeah, this one is so simple, but it's been amazing. I used to sleep whenever I got done with my work. I would wake up whenever I had to wake up, but there wasn't much of a system to that. Now, because I got board certified in lifestyle medicine just about a year ago, and what I learned from that is the very basic 7 hours of sleep on average, plus or minus half hour to an hour, is so fundamental to maintaining our health. And that's something I never thought of before. So now every day, I go to sleep by about 10:30, and I wake up at 5:30, right? And when I do that, my days are amazing, right? And so it decreases stress, it increases function. So yes, something simple like that. It doesn't take rocket science to figure out some of these basics, from what you eat to how you sleep, and a few other principles there.
I think sleeping and exercise, basically, you are emphasizing on that. Exercise and good quality food is important, in moderation, of course.
Absolutely, and I think it prevents disease, right?
Absolutely.
So it's better for us, we're going to be healthier people, right? Yes, we're living longer, right? I myself have brain cancer. I wouldn't make it as far as I'm going to make it in this generation because of the technology and the science. But keeping people alive longer after a heart attack, it's wonderful, but preventing that heart attack is even better.
All right. So, let's talk about technology and AI. They are moving fast in medicine. So, my question to you is how far should artificial intelligence be allowed to replace or support healthcare providers? And where do you draw the line?
Yeah, so I think that's a well-worded question, right? So replacing versus assisting. And based on just that difference, the American Medical Association, we don't refer to AI as artificial intelligence. We refer to it as augmented intelligence. It should help us take care of our patients. And I think the reason for that is it's rapidly evolving. Right? When I think about what AI, the conclusions it came to within healthcare just less than a decade ago and where it is now, it's moving in the right direction. Initially, the physician community was very concerned about AI. Now, the majority are excited about what AI can do. But there are certain principles we should follow, right? If we just let it grow as fast as it can without having some guardrails about what it should and shouldn't do, then we're going in a dangerous direction with some amazing technology. Right? And so we need to be careful about how it develops in our country. It should be something that helps physicians. We're not at that point where it can substitute for physicians. Right? It needs to be something that also the products that we see, right? If you go to the Consumer Electronics Show, you'll see acres of technology and AI and all these things, but you won't see many acres. Right? And how is it that you can separate the people that will use that technology from the creation of that technology? That's bad. The same thing happened with electronic health records. Right? We've been using those for 15 or so years, but physicians were never involved in the development. What is the consequence of that? If I'm a patient in New York City and I go to an emergency room and something is important is done, and then I go back to my home in Michigan and I see my doctor and they want to know what happened in New York, you know what we have to do? We have to use a fax machine.
Wow.
That is crazy in 2025.
Exactly.
So that's because the electronic health records are not interoperable. We don't want to make the same mistake by seeing AI develop but not having principles that guide it. And so that's very much the American Medical Association's goal, is to have physicians involved and to guide the evolution of something amazing like augmented intelligence.
You know, I know you guys, especially doctors, they do make a lot of charts after, they see a patient and stuff like that. So do you use like ChatGPT and stuff like that for that?
Yeah, so we don't use ChatGPT in our office, but we did actually add an AI tool to our electronic health record, and it's amazing. I love it. This was just about 2 months ago. The reason it's amazing is that before, like when I went to medical school, we would sit with our chart, we would sit with our pen, we would look right at a patient, and we'd be writing things down while we're talking to them.
Right.
Then electronic health records came out. Now, I'm looking this way at my keyboard, occasionally looking at my patient, typing, looking, typing. That's a problem, right? This connection has suffered.
Yes.
But now because of AI on my laptop, I just hit the button, I'm looking at the patient, AI is listening to everything we both say, and it comes up with a very good note. And I review it to ensure that it's accurate, and then just the record itself is much better. I've never been a fantastic typist. So when I ask 10 questions, I'd be lucky to type out that question and answer for 50% of them.
Right.
I know all the answers, but documenting them is just a problem if we have to do this. But when the machine is listening, while I'm asking the questions to my patient, that is fantastic.
Yeah, I think it's a good tool, especially for, I feel, you guys, doing it. And you that way can give more, eye-to-eye contact with the patient. And then you can do all this. I think it's wonderful. And I also wanted to ask you, is there one, AI or tech tool, you're actually excited about using?
Yeah, so honestly, the one I'm excited about is the one we just described, just the documentation. It's so simple, but it's so effective. And again, just that subtleness of being able to look at my patient, talk to them directly. Personally, I was shocked. That wasn't a benefit that I expected, but it is so powerful. But in addition to that, like for example, the imaging that we do, right? The X-rays, the MRIs, to have AI help us, and that's honestly something that we've been doing for a while with mammograms. Right? So looking for the tissue within the breast, looking for cancer, to have that read by a computer and then double checked by a human being, by the radiologist. That's technology that we've had for a while. But now that's going to evolve very quickly, right? To have AI help us with analysis of imaging. And the other example I use a lot in my speeches. So on a Friday evening, right, if it's the last patient of the day and I'm ready to go home, and they tell me they have a external ear infection, and I say, okay, that's what we usually use. And I give them that prescription. But now if I had AI running in the background, AI will know exactly the headline that made the newspaper the day before that says where that patient lives. They live on this lake. That lake has a high level of E. coli bacteria. Therefore, you should use this antibiotic instead of this antibiotic. That's something I would have never figured out.
Yeah.
Right? I would have put them on a standard treatment instead of something unique to their history and situation and what was in the news that day. That is amazing use of technology. So that's the kind of thing I'm excited about. It makes me smarter when I'm taking care of my patients.
Absolutely. And let's talk about your hometown, Flint, which is personal for you. So I want to ask you, what made you come back home instead of building a career elsewhere, you know?
Well, so there's the amazing answer that's almost scripted, where I want to go to my community, I want to help a community that's short of physicians. And that's absolutely true. But the very basic reason was that my wife and I just had our twin boys. They were 1 month old. And at that point, I had to make a decision. Do I want to raise these kids while I'm working in a city where I don't have any relatives, where it'll be hard to take care of my children and grow my career? Naturally, many people, just like I did, would say, you know what, let's go home where our parents are, where our in-laws are, the practical nature of it. And so I would say it's both of those things, the practical aspect of having a new family with the help of their parents, of my parents, their grandparents, and also going back to the community where I grew up. Right? So this community gave so much to my family. As physicians, they were new to this country in 1970. So this is a way of giving back to the city that gave us so much. And so there are multiple reasons, from the the philosophical, moral reasons to the very basics of having babysitters built into the family.
You know, that's really a beautiful, beautiful thought. So my last question to you will be like, when you're not in clinic or in meetings, what does a perfect, no agenda day look like for Bobby Mukkamala?
So every day I wake up, I have a to-do list. So Flint, Michigan is the birthplace of General Motors, right? In fact, the house that my wife Nita and I live in was one of the Man of the Year by Time Magazine as president of General Motors. So it's a car town. So I have a car collection that I've been collecting for the past 25 years. So when I have time, I go and I wrench on the cars, I fix something, I take it for a test drive. So that's my meditation.
Wonderful. And any last words of wisdom for our ITV Gold viewers?
Well, you know, it's amazing being in India right now, bringing several trustees of the American Medical Association to see Bharat, to see where my parents grew up, and to see healthcare from a different perspective, right? This is more than 1 billion people, and the healthcare system needs to take good care of them. So how does that work? And how good is it? And what we can learn from that, and what we can contribute to that. I don't like the idea of being on separate parts of the planet and trying to invent things on our own, right? This is where collaboration, especially again, where 10% of the physicians in the United States are of Indian origin. So I'm happy, I'm honored to be able to bring them to India to see what healthcare is like and what the system works like and the health of the people in this country, to help the left and the right hands work together.
You know, thank you so much. It was lovely talking to you and wishing you all the best and safe travels.
Thank you. Thank you very much.
Thank you.